Hi, Lucy. How are you?
Great. How are you?
Good.
Good.
Good afternoon, everyone. We'll get started in 2 minutes. Good afternoon, everyone. Welcome to the Calhoun County Joint Information Center briefing for Wednesday, March 10th, 2021. Administrative notes and our unified command team. Additional speakers today. The Joint Operations Center information, purpose of the Joint Operations Center, and the agenda. Okay, next slide. With the current situation, current status from the Health Department, Bridget Reichenbach. Bridget, go right ahead.
Good morning, everyone, or afternoon, I guess. I don't even know what time it is. As you can see, there are 8,628 positive COVID cases within Calhoun County for a total of 396 hospitalizations and 220 deaths. In the last 24 hours, we've had a total of 76 cases. That is concerning. And if you look at the graph all the way to the right, that number seems to be climbing a little bit. So we are concerned about that. And again, we'll continue to watch the trend and see where we are going. Next slide, please. Here we have a new slide. It shows our comparison from Calhoun County to the state. This is the graph on the left is the total number or percentage of residents age 16 and over that have received the first at least one dose of the vaccine. We are just below the state average there. However, we are just over the state average for those that have completed both doses of the vaccine. And currently in Calhoun County, there have been just over 35,000 doses given. 22,000 of those are first dose, and almost 13,000 have received both first and second doses. Next slide. Also here, this focuses on the individuals that are 65 plus. And again, we are just over the state average for those that have received their first dose and just over the state again, and those that have completed the series receiving both doses of the vaccine. And again, here in Calhoun, for those 65 plus, it's about 21,000 doses that have been administered to our residents. Next slide. I'd like to talk about, we received a grant from the Michigan Department of Health and Human Services. It is a community outreach pilot program project for vaccination of vulnerable individuals age 60 and over. It was a quick turnaround on this grant. We submitted it last week and received notification on Monday that we did receive this grant. What it is 1,500 doses of Moderna vaccine that will be given out to, again, our most vulnerable census tracts within the county. And on the map, you can see there are 8 census tracts that fit within the criteria that we determined, and 2 in Albion. And those criteria were the census tracts to identify those that have difficulties getting the vaccine, including transportation, English speaking, and I'm missing something. I will look that up in a second. So we're really glad that we were able to get that grant. We have allocated 1,000 of those doses to Battle Creek tracts and 500 to Albion. And those clinics will be done on March 20th. This is a partnership between both Oaklawn Hospital, Bronson Battle Creek, and us, and along with many community partners, including both chapters of the NAACP, the Urban League, VOSIS, the Burma Center, and Albion Healthcare Alliance, quite a few partners with this grant. Next slide. Want to talk quickly about our vaccine eligibility. On March 8th, as you know, the state opened up the vaccine eligibility to those 50 and older with underlying health conditions, or those with disability, or caregivers of family members with disabilities, and guardians age 16 and older of children who with special health care needs. The health department is also implementing a new process. We have purchased a software that's a scheduling software that will be soon available. We have not rolled that out yet. So those will be, the link will be posted for all residents within the county to sign up to be on a wait list for the vaccine as clinics are scheduled and as vaccine is available. Currently, frontline workers will be scheduled through their employers based off of the phase 1B form that is already posted on our website. And again, I want to be clear on that those individuals, when they're getting through vaccine through their employers, the employer itself will submit a form of how many individuals are interested in and qualified to receive the vaccine, and then we will schedule those separately from the general residents within the county. And again, we will be posting links once we open for our 1C groups on our vaccine webpage, which is listed here as well. Next slide. And here is a table that shows our current vaccine phases for 1B. And on our website too, we will have, or do have, I'm not sure if it's posted yet, a color-coded chart to show within the phases which ones have been completed, which ones we're working on, and which ones are yet to be scheduled. Next slide. I think that's it.
Okay.
Yes, thank you.
Thank you very much, Bridget, for your report. Appreciate it. Moving on to our next agenda item. It is to discuss fully vaccinated CDC recommendations. And here is the Calhoun County Administrator, Kelly Scott. Kelly, go right ahead. And you are muted, Kelly.
Thank you very much, Dirk. I needed that help today. Good afternoon, everyone. I know my ultimate goal in getting vaccinated against COVID-19 is to become personally protected against the virus and its health effects, and also as part of a family and as part of our community and a society, I want to be part of the solution to end its continued spread. So since the vaccine is still fairly new, there have been some questions and uncertainty about the implications of interacting with others, since some of us are now vaccinated and many are not. Some of these questions I have received: once I'm fully vaccinated, can I still get COVID-19 and maybe I just won't be sick? Could I then pass it on to someone else in my family that hasn't been vaccinated? If I've been vaccinated and then I become a close contact of someone who tests positive, will I still need to quarantine? And is it safe for me to travel once I'm fully vaccinated? So yesterday, the Centers for Disease Control and Prevention, or CDC, attempted to answer some of these questions, not all, issuing new guidelines on March 9 designed to ease restrictions for Americans who are fully vaccinated against COVID-19. Sometimes guidance that is meant to clear up confusion can actually add to the confusion. So we are cautiously sharing this information today because if it is carefully read and followed, I think it is welcome news to those of us who are just tired of the pandemic and are wanting the hope of future normalcy. And we want that hope to be reinforced in this official way. So the CDC is starting to do that. So first, the definitions, just to make sure it's clear, you are considered fully vaccinated in the definition of all of this new guidance, only 2 weeks after your second dose of the Pfizer or Moderna vaccine, or 2 weeks after your single and only dose of the single dose vaccine like the Johnson & Johnson. So if it has been less than 2 weeks since you got your shot, or if you still need to get your second dose, you are not fully vaccinated. And of course, these new guidelines shouldn't really change the prevention steps that we've all been following pre-vaccination. And then most importantly, we hope that this new guidance is one more reason to encourage our community members and our family members to get vaccinated when it is your turn to help stop the spread of COVID-19. Next slide. As I mentioned at the beginning, the CDC has enough data collected from vaccinated Americans to provide some specific guidance. The expectation is that as time goes on, more evidence will lead to further guidance, for example, about travel, which the agency has yet to release and answer that question. For now, what they are indicating specifically is that fully vaccinated people can visit with other vaccinated people without masks and distancing, visit with unvaccinated people, as we have been, from single households who are at low risk. And I think most importantly, and we've been watching this as an employer, and we've built this into our updated policies, that you will not need to quarantine or testing following a known exposure if you're asymptomatic. So if you do become a close contact to someone who tests positive, you are not sick, no need to stay out of work and quarantine yourself. For now, the guidance still is suggesting that all people, including fully vaccinated people, should continue to take the precautions primarily in public, where you don't know who's been vaccinated or not, and where in Michigan, at least, we still have requirements to wear a mask and to be physically distanced. When visiting with people that are unvaccinated or you really don't know because we're not marked in that way, still continue all of the same protocol. So the bottom line is that our individual choice to get vaccinated should, and in fact does, increase our level of personal protection and freedom. It doesn't mean that we should have a false sense of security, however, and we should still remember that overall safety measures like wearing masks in public and avoiding medium to large St. Patrick's Day parties are still needed. This is because there isn't yet much data on asymptomatic transmission even after fully vaccinated. And because the CDC is reporting, and you saw on Bridget's slides, that at this point, less than 20% of our overall national population has received the dose of vaccine. So we've all seen enough harm and death to our loved ones caused by COVID-19 to appreciate the vaccine and to appreciate this official easing of restrictions that come with it. And yet I know I don't want to rely on the luck of the Irish being with me next week, as gatherings are sure to include now a mix of those that are fully vaccinated and those who may be COVID positive. So have a safe and a blessed St. Patrick's Day next week.
Okay, Kelly Scott, thank you very much for your report. We appreciate it. Coming up next on our agenda, under additional speakers, will be Christy Gristini, the Battle Creek Transit Mobility Manager, to discuss public transit. Christy, go right ahead.
Good afternoon, everyone. I am very excited to announce that we have just launched a coordinated mobility pilot on March 8th that allows us to coordinate services with other local transportation agencies to provide transportation throughout Calhoun County. This pilot, operating under the name BC Go, is funded through a Michigan Department of Transportation Service Initiatives grant and is expected to operate for a period of 12 months. The coordinated mobility pilot was a concept developed by the collaborating agencies to demonstrate the feasibility of coordinating services between multiple providers, preventing us from duplicating our services and utilizing each agency's assets to the fullest. This is a premium on-demand transportation service that acts like many of the ride-sharing services that you guys may have already been familiar with. To access this service, users can download the BC Go Calhoun County app in the Google Play Store or your Apple Store. It has been a little bit of a slower rollout than we had anticipated. So if the app is not available in your app store, you can download it from a link provided on our Battle Creek Transit Facebook page. We do encourage you to download the app, as this app provides up-to-date information, including vehicle location, estimated arrival time, and on-demand trip request. Users can also book rides up to 2 weeks in advance. Individuals without a smartphone don't have to worry. They can still book trips by calling the Battle Creek Transit Dispatch and letting us know they just want to book a ride on BC Go. This pilot will initially run Monday through Friday from 6 a.m. to 9 p.m. and Saturdays from 9 a.m. to 5 p.m. Fares, which can be paid on board or through the app by using a credit card, range from $3 to $15 and are based on the distance traveled. There is a $3 fee for any additional passengers that may be accompanying you on your trip. Children must be at least 8 years of age and not require the use of child restraints, including car seats and booster seats. Children over the age of 13 can travel independently on this service. This pilot is a shared ride service, so the technology will match multiple passengers who are heading in the same direction. Customers using this service can expect us to pick up and drop off additional passengers on the way to their destination. Also, as this pilot demonstrates the coordination of transportation service among the collaborating partners, Battle Creek Transit and Community Action, not all vehicles operating the service may reflect the BC Go name or branding. So someone may be using Battle Creek Transit's BC Go vehicle to get to their location, but their return trip could be booked on a community action vehicle to get them home. To keep everyone safe, we do have some safety restrictions currently in place. Our vehicle capacity is limited to only 2 passengers at a time right now. Also, we are currently under a federal mandate that does require all passengers to wear a CDC-approved face mask while riding on all transit vehicles. Lastly, I just want to make sure to know that this service can be used by anyone. We can take you to work, to school, to doctor's appointments, for a lunch date with friends. If you are traveling within Calhoun County, this is the perfect service for you.
Okay. Christy Gristini, we do have a hand up from Lucy Blair. Lucy, did you have a question?
No, I'm just very excited about this service. That's all.
Fantastic.
Oh, good. We're happy to hear that.
Fantastic information, Christy. And thank you so much for joining us today. We appreciate it.
Oh, you're very welcome. Thank you for having me.
You're always welcome. Moving on to our next slide. Comments from elected officials. And we will begin with Senator Bizon or his office.
Hi, this is Karen from Senator Bizon's office. Nothing to report today. Thank you.
Okay, Karen, thank you very much. Representative Hansma. Jim, go right ahead.
Thank you, Derek. Here in Lansing, we continue to work on appropriating dollars associated with the late December 2020 monies from Washington. You may have read in the paper or may have seen on television or heard via radio that the governor did approve some of the bills that came to her last week, but line item vetoed many of the provisions. There continue to be about $2 billion that's so far gathering dust, as the governor put it, in Washington. We still have time to ensure that those monies come and hopefully can be used to fortify local governments, local businesses, and families who might be facing eviction or have food insecurity. And I'm heading over there now, but finally I'd like to add to that which Lucy indicated. I think this is very exciting news, Christy, from Calhoun County collaborative perspective in relation to transportation, shared transportation across the county. I'm very pleased to have heard your report. Thank you.
Very good. Thank you, Jim, so much for joining us and your report today, sir. Representative Hall or his office.
Yeah, this is Matea from Representative Hall's office. We don't have any updates at this time, but thank you.
Okay, Matea, thanks for joining us today. We appreciate it. Comments from county elected officials. Okay, hearing none, we'll go to tribal elected officials.
Good afternoon. This is Dory Rios, Tribal Council Vice Chair from the tribe. We have no new updates at this time. Thank you.
Okay, Dory, thank you for joining us today. Next up, city elected officials. And hearing none, township elected officials. And hearing none, we'll move on to village elected officials.
Yes, this is Mike Alverson, Village of Athens. And I wonder if Representative Hadsma could maybe answer the question as far as, monies coming down from the federal government that are just sitting in Lansing. What type of time we have before that has to be turned back to Washington?
Mike, the dollars are in Washington, not Lansing. I don't know what time parameter yet exists, but I'll find that out and I'll communicate that to you.
Thank you.
You're welcome.
Jim, thank you. And Mike, thank you for your question. We appreciate it. Next slide, please. Okay, our best information sources. And finally, our last slide, contact us. If you want to make a more personal contact, here are 3 great people that you can choose from. And with that, I will end the meeting and thank you for joining us. I hope everybody is safe this week and enjoy the rest of your day and the weather. Take care.